Please take a moment to read the indication and select important safety information, including the boxed warning on serious infusion-related reactions and neurotoxicity. Also refer to the additional important safety information at the end of the video. Hello, I'm David Dickens, a pediatric oncologist for over 20 years. In this video, I'll address responses seen in the DANYELZA with GM-CSF registrational studies, and then focus on results from the Study 201 pre-specified interim analysis. Specifically, I'll present the results in all efficacy evaluable patients and in those with a prior incomplete response to induction therapy. As a reminder, DANYELZA may be considered for high-risk neuroblastoma patients with disease in the bone and/or bone marrow who have an incomplete response to induction therapy or have had an incomplete response to relapse therapy. Note that incomplete response is defined as a partial response, minor response, or stable disease to prior therapy. There were 2 DANYELZA with GM-CSF registrational studies, which are described in detail in Chapter 2. Study 12230 was a Phase 1/2 trial with 38 patients included in the efficacy analysis. Study 201 is a Phase 2 trial that had 22 patients in its initial efficacy analysis. A pre-specified interim analysis for Study 201 was conducted, for which additional patients were recruited, bringing the number of patients in the efficacy analysis to 52. The primary endpoint was overall response rate, or ORR. ORR was defined as complete response or partial response according to the INRC 2017 and confirmed by at least one subsequent assessment. In Study 12230 and the initial analysis of Study 201, in other words, the registrational studies, more than 1/3 of patients responded and more than 1/4 achieved a complete response. Now let's look at results from the Study 201 interim analysis. Shown here are the overall, complete, and partial responses for all 52 patients in the efficacy analysis. With a median follow-up of 5.9 months, 40% of patients responded to DANYELZA with GM-CSF, and 29% achieved a complete response. The remaining 11% of responders achieved a partial response. For these responding patients, the median duration of response was not estimable because responses were ongoing or patients were censored at the time of data cutoff. Next, let's review response rates in the pre-specified subgroup of patients with an incomplete response to induction therapy. As a reminder from Chapter 2, which includes baseline characteristics, half the efficacy evaluable patients in the Study 201 interim analysis fell into this category. Shown here are the overall, complete, and partial responses for these patients. As you can see, 46% responded to DANYELZA with GM-CSF, and 31% achieved a complete response. The remaining 15% of responders achieved a partial response. In the swimmer plot, you see patient-level data of patients who had an incomplete response to induction therapy. The plot shows responses and Curie scores at baseline and at subsequent points following initiation of treatment with DANYELZA plus GM-CSF. The colors within the bars correspond to the response, with gray reflecting no assessment was performed, and darkening shades of blue reflecting deeper responses. The letters represent an assessment time point, and a dark square represents progressive disease. The numbers to the right of the bars are each patient's Curie scores during treatment, and they are plotted in the bars at the times they were assessed. Curie score assessments were performed at baseline, at first assessment of response, and at each subsequent assessment of response. The baseline Curie score, which is the second column of numbers, is the Curie score assessed before the first administration of DANYELZA with GM-CSF. Feel free to pause the video if you'd like to take a few moments to review this information. To learn more about Curie score in high-risk neuroblastoma, please refer to Chapter 1. To learn more about results in the subgroup of patients in the Study 201 interim analysis with an incomplete response to relapse therapy, please refer to Chapter 5. I hope you found this video informative. To learn more about DANYELZA, you can watch the other chapters in this video series and visit DANYELZAHCP.com. Now please take a moment to view the important safety information for DANYELZA. Thank you.
Indication. DANYELZA is indicated in combination with granulocyte macrophage colony stimulating factor, GM-CSF, for the treatment of pediatric patients 1 year of age and older and adult patients with relapsed or refractory high-risk neuroblastoma in the bone or bone marrow who have demonstrated a partial response, minor response, or stable disease to prior therapy. This indication is approved under accelerated approval based on overall response rate and duration of response. Continued approval for this indication may be contingent upon verification and description of clinical benefit in a confirmatory trial. Important safety information. Warning: serious infusion-related reactions and neurotoxicity. Serious infusion-related reactions. DANYELZA can cause serious infusion reactions, including cardiac arrest, anaphylaxis, hypotension, bronchospasm, and stridor. Infusion reactions of any grade occurred in 94 to 100% of patients. Severe infusion reactions occurred in 32 to 68%, and serious infusion reactions occurred in 4 to 18% of patients in DANYELZA clinical studies. Pre-medicate prior to each DANYELZA infusion as recommended, and monitor patients for at least 2 hours following completion of each infusion. Reduce the rate, interrupt infusion, or permanently discontinue DANYELZA based on severity. Neurotoxicity. DANYELZA can cause severe neurotoxicity, including severe neuropathic pain, transverse myelitis, and reversible posterior leukoencephalopathy syndrome, RPLS. Pain of any grade occurred in 94 to 100% of patients in DANYELZA clinical studies. Pre-medicate to treat neuropathic pain as recommended. Permanently discontinue DANYELZA based on the adverse reaction and severity. Contraindication. DANYELZA is contraindicated in patients with a history of severe hypersensitivity reaction to naxitamab-gqgk. Reactions have included anaphylaxis. Warnings and precautions. Serious infusion-related reactions. DANYELZA can cause serious infusion reactions, requiring urgent intervention including fluid resuscitation, administration of bronchodilators, and corticosteroids, intensive care unit admission, infusion rate reduction, or interruption of DANYELZA infusion. Infusion-related reactions included hypotension, bronchospasm, hypoxia, and stridor. Serious infusion-related reactions occurred in 4% of patients in Study 201 and in 18% of patients in Study 12-230. Infusion-related reactions of any grade occurred in 100% of patients in Study 201 and 94% of patients in Study 12-230. Hypotension of any grade occurred in 100% of patients in Study 201 and 89% of patients in Study 12-230. In Study 201, 68% of patients experienced grade 3 or 4 infusion reactions, and in Study 12-230, 32% of patients experienced grade 3 or 4 infusion reactions. Anaphylaxis occurred in 12% of patients, and 2 patients, 8%, permanently discontinued DANYELZA due to anaphylaxis in Study 201. 1 patient in Study 12-230, 1.4%, experienced a grade 4 cardiac arrest 1.5 hours following completion of DANYELZA infusion. In Study 201, infusion reactions generally occurred within 24 hours of completing a DANYELZA infusion, most often within 30 minutes of initiation. Infusion reactions were most frequent during the first infusion of DANYELZA in each cycle. 80% of patients required reduction in infusion rate, and 80% of patients had an infusion interrupted for at least 1 infusion-related reaction. Caution is advised in patients with pre-existing cardiac disease, as this may exacerbate the risk of severe hypotension. Pre-medicate with an antihistamine, acetaminophen, an H2 antagonist, and corticosteroid as recommended. Monitor patients closely for signs and symptoms of infusion reactions during and for at least 2 hours following completion of each DANYELZA infusion, in a setting where cardiopulmonary resuscitation medication and equipment are available. Reduce the rate, interrupt infusion, or permanently discontinue DANYELZA based on severity, and institute appropriate medical management as needed. Neurotoxicity. DANYELZA can cause severe neurotoxicity, including severe neuropathic pain, transverse myelitis, and reversible posterior leukoencephalopathy syndrome. Pain. Pain, including abdominal pain, bone pain, neck pain, and extremity pain, occurred in 100% of patients in Study 201 and 94% of patients in Study 12-30. Grade 3 pain occurred in 72% of patients in Study 201. 1 patient in Study 201, 4%, required interruption of an infusion due to pain. Pain typically began during the infusion of DANYELZA and lasted a median of less than 1 day in Study 201, range less than 1 day and up to 62 days. Pre-medicate with drugs that treat neuropathic pain, e.g. gabapentin, and oral opioids. Administer intravenous opioids as needed for breakthrough pain. Permanently discontinue DANYELZA based on severity. Transverse myelitis. Transverse myelitis has occurred with DANYELZA. Permanently discontinue DANYELZA in patients who develop transverse myelitis. Reverse posterior leukoencephalopathy syndrome, RPLS. Reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome, or PRES, occurred in 2.8% patients in study 12-30. Events occurred 2 and 7 days following completion of the first cycle of DANYELZA. Monitor blood pressure during and following DANYELZA infusion and assess for neurologic symptoms. Permanently discontinue DANYELZA in case of symptomatic RPLS. Peripheral neuropathy. Peripheral neuropathy, including peripheral sensory neuropathy, peripheral motor neuropathy, paresthesia, and neuralgia, occurred in 32% of patients in Study 201 and in 25% of patients in Study 12-30. Most signs and symptoms of neuropathy began on the day of the infusion, and neuropathy lasted a median of 5.5 days, range 0 to 22 days, in Study 201, and 0 days, range 0 to 22 days, in Study 12-30. Permanently discontinue DANYELZA based on severity. Neurological disorders of the eye. Neurological disorders of the eye, including unequal pupils, blurred vision, accommodation disorder, mydriasis, visual impairment, and photophobia occurred in 24% of patients in Study 201 and 19% of patients in Study 12-30. Neurological disorders of the eye lasted a median of 17 days, range 0 to 84 days, in Study 201, with 2 patients, 8%, experiencing an event that had not resolved at the time of data cutoff, and a median of 1 day, range less than 1 day to 21 days, in Study 12-30. Permanently discontinue DANYELZA based on severity. Prolonged urinary retention. Urinary retention occurred in 1 patient, 4%, in Study 201, and in 3 patients, 4%, in Study 12-30. All events in both studies occurred on the day of an infusion of DANYELZA and lasted between 0 and 24 days. Permanently discontinue DANYELZA in patients with urinary retention that does not resolve following discontinuation of opioids. Myocarditis. Myocarditis has occurred in adolescent patients receiving DANYELZA in clinical trials and expanded access programs. Myocarditis occurred within days of receiving DANYELZA, requiring drug interruption. Monitor for signs and symptoms of myocarditis during treatment with DANYELZA. Withhold, reduce the dose, or permanently discontinue DANYELZA based on severity. Hypertension. Hypertension occurred in 44% of patients in Study 201 and 28% of patients in Study 12-30 who received DANYELZA. Grade 3 or 4 hypertension occurred in 4% of patients in Study 201 and 7% of patients in Study 12-30. 4 patients, 6% in Study 12-30, permanently discontinued DANYELZA due to hypertension. In both studies, most events occurred on the day of DANYELZA infusion and occurred up to 9 days following an infusion of DANYELZA. Do not initiate DANYELZA in patients with uncontrolled hypertension. Monitor blood pressure during infusion and at least daily on days 1 to 8 of each cycle of DANYELZA, and evaluate for complications of hypertension, including RPLS. Interrupt DANYELZA infusion and resume at a reduced rate, or permanently discontinue DANYELZA based on the severity. Orthostatic hypotension. Orthostatic hypotension has occurred in patients receiving DANYELZA in clinical trials and expanded access programs. Severe orthostatic hypotension, including cases requiring hospitalization, have occurred. Cases occurred within hours to 6 days of DANYELZA infusions in any cycle. In patients with symptoms of orthostatic hypotension, monitor postural blood pressure prior to initiating treatment with DANYELZA and as clinically indicated with subsequent dosing. Withhold, reduce dose, or permanently discontinue DANYELZA based on severity. Embryo-fetal toxicity. Based on its mechanism of action, DANYELZA may cause fetal harm when administered to a pregnant woman. Advise females of reproductive potential, including pregnant women, of the potential risk to a fetus. Advise females of reproductive potential to use effective contraceptive during treatment with DANYELZA and for 2 months after the last dose. Adverse reactions. The most common adverse reactions in studies 201 and 12-30, greater than or equal to 25% in either study, were infusion-related reaction, pain, tachycardia, vomiting, cough, nausea, diarrhea, decreased appetite, hypertension, fatigue, erythema multiforme, peripheral neuropathy, urticaria, pyrexia, headache, injection site reaction, edema, anxiety, localized edema, and irritability. The most common grade 3 or 4 laboratory abnormalities, greater than or equal to 5% in either study, were decreased lymphocytes, decreased neutrophils, decreased hemoglobin, decreased platelet count, decreased potassium, increased alanine aminotransferase, decreased glucose, decreased calcium, decreased albumin, decreased sodium, and decreased phosphate.